I remember at the time the media coverage when that select committee, I think it was yourself and Kevin Flynn
Yes.
and the New Democrat escapes me right now.
It was France Gélinas at
Right.
the beginning, yes.
It was held up as an example of the good work that can be done when people from different parties kind of, okay, let's put aside that stuff, that partisan stuff right now, because this is important and we can do good work here and make a contribution. That was held
Yes.
up at the time as an example of that actually can happen.
It can't happen. It can't happen for everything because there's lots of issues where we fundamentally disagree. And when you get into some of the economic discussions, that would not work.
No.
But there are a lot more topics, I think, than people would realize where select committees can be very helpful.
All right, so at a high level then, we're spending lots per capita on our healthcare system. Maybe we need to manage those funds differently. We need to make some operational sort of adjustments as to how people get treated. From your
Yes.
view, that's kind of the way that we should be at least thinking about going forward?
Yes, and I think one of the ways that we can do that, and which I learned from my last job as patient ombudsman, is to make sure that we center care around the patient. And a lot of people are surprised at that because they think that's the way our healthcare system is structured. It's not really. It's centered more around providers right now. But studies have indicated that if you take it back to what does a patient really need and expect in their care, you can probably eliminate a lot of steps that aren't necessary, and that saves money.
Yeah, and I mean, full disclosure, we work for some organizations that think they have a lot more to contribute. The Ontario Pharmacists Association, for example, that are looking at if their scope of practice were expanded even a little bit, they could take some of the pressure off of doctors' offices and ERs. And, I mean, we did the flu shot in pharmacy program, which I think has led to fewer people getting the flu.
Yes.
So that they're an example of a group that, in their discussion with government, is like, if you let us do this much more in consultation with their regulatory college, then it kind of frees up pressure over here. It creates some capacity elsewhere in the system, and maybe you don't need to go to the emergency room on a Saturday night for something minor because that's the only place that's open.
Yes,
Right?
yes.
So I think that's a good example. And you recall we came to meet with you with the OPA
Yes.
at the time, and you were very open to that.